Basic anatomy. Anatomical terminology. Understand anatomical terms in Latin or English to refer to body positions, such as anterior, front, versus posterior, back. Superior, above, versus inferior, below. Medial, near the midline, versus lateral, away from the midline. Anatomical terminology is a system of terms used to describe the structure and position of the human body in a consistent and accurate manner. These terms are essential in medicine, biology, and other health sciences as they help medical professionals, researchers, and students communicate clearly about body structures and their orientations. Anatomical terminology avoids the confusion of local descriptions that can vary between individuals, allowing for a more universal understanding. Here is a detailed explanation of anatomical terminology covering body positions, directions, planes, and important terms used to describe parts of the human body. 1. Basic anatomical position. The basic anatomical position is the standard position used to depict the human body in the study of anatomy. All descriptions of the body's direction and location are based on this position. Anatomical position. The human body is standing upright. The head is facing forward. The arms are at the sides of the body with the palms facing forward. The feet are parallel and facing straight ahead, with the toes pointing forward. Function. This position provides a consistent standard that makes it easier to describe the location and orientation of the body. 2. Directional terms. Directional terms are used to describe the position or relationship of a body structure to other body structures. Here are some important directional terms. Superior, cranial, refers to the direction closer to the top of the head or higher in the body. Example: the brain is superior to the spinal cord. Inferior, caudal, refers to the direction closer to the bottom of the body or lower. Example: the stomach is inferior to the lungs. Anterior, ventral, refers to the direction closer to the front of the body. Example: the stomach is anterior to the back. Posterior, dorsal, refers to the direction closer to the back of the body. Example: the back is posterior to the chest. Medial, the direction toward the midline of the body, or closer to the body axis. Example: the nose is medial to the eye. Lateral, away from the midline of the body, or farther from the body axis. Example: the ear is lateral to the eye. Proximal, indicates a position that is closer to the point of origin or a more central body part, e.g., the point where the arm attaches to the body. Example: the upper arm is more proximal than the lower arm. Distal, indicates a position that is farther from the point of origin or a more central body part. Example: the leg is more distal than the thigh. Superficial, indicates a position that is closer to the surface of the body. Example, the skin is superficial to the muscle. Profundus, deep, indicates a position that is farther from the surface of the body. Example, the bone is deeper, profundus, than the muscle. 3. Position terms. Position terms describe the orientation or relationship of the body in space or to other body structures. Some important position terms include supine, the position of lying on the back with the face facing up. Prone, the position of lying on the stomach with the face facing down. Fowler's position, a sitting position with the body slightly tilted forward, often used for patients who need help breathing. Lithotomy, a lying position with the legs raised and spread wide. Often used in gynecologic examinations or procedures. 4. Plane terminology. The term plane is used to describe cuts in the body in various directions. There are 3 main planes used in anatomy to describe slices of the body. Sagittal plane divides the body into left and right halves. If this plane is exactly in the middle of the body, it is called the median plane. Example, vertical cutting of the body from front to back. Frontal, coronal, plane divides the body into front, anterior, and back, posterior. Example, vertical cutting of the body from side to side. Transversal, horizontal, plane divides the body into upper, superior, and lower, inferior, halves. Example, horizontal cutting of the body to see the upper and lower body sections. 5. Organ and body system function terminology. These terms are used to describe specific functions and structures found in the human body system. Organ, structure that has a specific function in the body, such as the heart, kidneys, liver, etc. System, a group of organs that work together to perform a specific body function, such as the circulatory system, digestive system, respiratory system, etc. 6. Tissue terminology. Each type of tissue in the body has a specific name and description. Some terms related to body tissues include epithelium, tissue that lines body surfaces and body cavities. Connective, tissue that connects or supports other body parts. Muscle, tissue involved in body movement. Nerve, tissue that transmits electrical impulses to coordinate body functions. 7. Blood vessel and internal organ terminology. To describe the location or structure of blood vessels and internal organs, we use the following specific terms: arteries. Blood vessels that carry blood away from the heart to the rest of the body. Veins, blood vessels that carry blood back to the heart. Capillaries, small blood vessels that connect arteries and veins, where gas and nutrient exchange occurs. Body organs refers to body structures that have a specific function, such as the heart, lungs, liver, kidneys, etc. 8. Relative terminology. Several terms are used to describe the relationship or comparison between one body structure and another. Ipsilateral, located on the same side of the body. Example: the left arm and left leg are ipsilateral. Contralateral, on the opposite side of the body. Example: the right arm and left leg are contralateral. Bilaterally, referring to both sides of the body. Example: this disorder can affect the legs bilaterally. 9. Terminology of classification and description of structures. These terms are used to provide further explanation of anatomical structures in detail. Foramen, a hole or gap in a bone through which blood vessels or nerves pass. Fossa, a depression or indentation on the surface of a bone. Condyle, a rounded portion of a bone that serves as a meeting point with another bone, joint. Epicondyle, an area on the bone near the condyle that serves as an attachment point for ligaments or tendons. Tuberosity, a raised area on the surface of a bone for muscle attachment. Conclusion. Anatomical terminology is a system designed to provide clear and consistent explanations of the human body. It includes directions, positions, planes, and descriptions of body structures, all of which help in accurately describing the location and function of body parts. A good understanding of these anatomical terms is essential in the study of medicine and the health sciences, as it provides a precise language for communicating medical findings and diagnoses.